from the test that we've run, from what we've seen, both of us, you are HIV positive.
That's how it started. Nestled along the serene shores of Lake Victoria, in the heart of Homa Bay County, our story unfolds. Here in this picturesque town, life takes on a rhythm shaped by the waters that have witnessed generations come and go. Amidst the bustling streets and vibrant markets, we encounter faces of courage, resilience, and determination. Meet Cintas, a pseudonym she chose. An 18-year-old mother living with HIV. With a blurred face, she bravely shares her story. This one guy, he used to tell me that he loves me so much. I was just informed too then, due to this peer influence, that you see your friends are doing certain kind of a thing and you are among the friends and you're not doing it. So I decided, let me just give in. When we got together, I didn't know the status of this person. I asked him, can we go and know about our status? But he said, it's okay. Maybe we can use this one for self-test, using the self-test kit. So I agreed to it. He went and did it alone. I didn't know how it was being used. And he brought the results showing only one strip. So I knew maybe this is the right thing. So I decided to give in. And that's how it went. Then after some time, the guy left me. And I really wondered, why does he just have to leave me after all this? But it didn't come into my mind. I just continued my studies. I was just participating. Then all of a sudden I started hearing that I'm sick, I'm often sick. So without informing my parents, I decided to go to the hospital because sometimes I used to cough and I vomit in the morning. So I decided, let me go to the hospital. At least these people will test and know what is it. Cinta's journey began with a revelation that changed her life's course. She discovered she was not only pregnant during her teenage years, but also HIV positive. The doctor told me that I have to start the clinic. So I decided, okay, it has already happened. Nothing I can do. I can't abort because since I was a child, I was told abortion is a crime. So I decided, but one thing that I kept in mind is that how will I face my parents? How will I tell them? Especially my dad, who is really harsh. How will I face him? But I said, let it be. So they told me I have to start clinic. And there, for you to start a clinic, there's some other tests you need to do. So they wanted to do some tests. One of them was HIV. The test was done. Was part of it that again I was HIV positive. Yeah. They talked to me, they advised me on what to do. And there they gave me the drugs, the ARVs to start using. And from there, I decided, okay, it's fine. That's who I am.
this life, I'm the one who have chosen it, because I'm the one who decided to do what my fellows are doing due to peer influence, due to peer pressure, the negative one, which didn't help me. So I went ahead. I took the drugs. But what was ringing in my mind was, how was I going to kill myself? I wanted to commit a suicide. That's what I wanted to do.
The United Nations AIDS 2022 data underscores this reality, that over 860,000 Kenyan women aged 15 and above are living with HIV. The past year alone witnessed around 13,000 new HIV infections within this group, and by the end of 2022, the number of AIDS-related deaths among these young girls reached approximately 8,500.
My dad became so mad. He was shouting all over the compound that I have ashamed him. I'm good for nothing, daughter. I've done the worst thing. So I just had to bear it. So from there is where he told me that paying for your school fee, you've decided to be a mother. You relax. I have some other children, many. So let me handle them first. Let me pay for them school fee, they study. You, because you are now a mother, you are a grown-up, you relax. It was really hard on my side, but I just have to bear it because it was all my fault. Yeah.
The harsh reality of HIV infection among adolescents is staggering. These statistics represent lives, stories, and challenges that demand our attention. Teacher Daniel Obondi and Dr. Winnie Ochoro shed light on the triple threat effect, revealing the complex web of factors that young women like Cintas are facing.
The issue of maybe teenage pregnancy, it has been so common, especially the last 3 years we have been experiencing this problem. It's like they are exposed to the matters of sex, and they engage in unprotected sex. That is why it results to earlier pregnancy. And number two is the issue our students here, mostly they are exposed to the issue of disco matanga. It's very common around. Disco matanga is very common, that at night they can go, they participate in disco matanga, and you know what happens by the end of that exposure. They will end up maybe doing sex with those that they are participating with. It's very common around, and that one also makes them to engage in premarital sex, hence getting pregnant.
Most of the time you get like challenges like the pregnancy, even the HIV has come because of the social background that this lady is in, like school fees, buying these small things like sanitary pads. Yeah. So usually it's the poverty that leads them to having a boyfriend, or maybe running to marriage, the early marriages that we have around. So it is just poverty that leads them to these things. So they go there ignorant, knowing nothing. So they just get into sexual, in fact, unprotected sexual intercourse.
From the serene shores of Homa Bay, our journey takes us to the bustling streets of Nairobi, the heartbeat of Kenya. Here, we delve deeper, seeking insights from dedicated professionals who make a difference. In a clinical psychology office, we find Faith, a compassionate psychologist from Chiromo Hospital. She sheds light on the common challenges faced by those battling HIV, where thoughts of isolation and despair often loom large.
Someone diagnosed with HIV and AIDS might experience symptoms of depression. For example, feeling worthless, feeling hopeless, feeling like their life has come to an end. It's a death sentence. And of course, this is based on the information that was there in the past. But currently, treatment has really advanced, and now people are able to get, medication, and they're able to actually live healthy lives. So because of this effect of, or the mindset that one has, that once I have this diagnosis, then my end goal is death. So they end up starting to get affected psychologically, and they experience negative thoughts. One of them now being those feelings of hopelessness will lead to suicidal thoughts.
Our pursuit of understanding leads us to Elizabeth Glacier's Pediatric AIDS Foundation in Nairobi, where dedicated team stands united in their commitment to support those living with HIV.
Adolescent girls and young women specifically suffer a lot of stigma. These are the same women who have high rates of pregnancy. In Kenya, about 20.4% of the women presenting to our clinics are adolescent girls and young women. And so in the setting of HIV, with the intersection between the adolescent period, the mental health vulnerabilities, self-stigma and social stigma as a result of HIV infection, we find that a lot of, especially pregnant adolescent girls and young women, are not being retained in care. What that means is that they can be seen in the clinic and initiated on treatment, but many of the time they are getting lost to follow-up, or they're not taking their antiretroviral treatment well, and this is really contributing to the maternal to child HIV transmission, specifically in this population.
Through empowerment program and community initiatives, they strive to shatter the chain of stigma and create a future of hope.
If you take your drugs well, even WHO has said that we have the undetectable equals to untransmittable. I mean, you equals to you, meaning that you will not transmit to your baby. So one of the important things is that overcome the stigma and get to your health facility. And in most of our health facilities, you'll find healthcare workers who are willing to support you and linking you up to other groups. We have psychosocial support groups of young women, of adolescents, both who are mothers and those who are not. And in that you will learn how to overcome the stigma, overcome discrimination, and also help you how to wade into pregnancy when you're ready, and when you're ready to have a baby who would be HIV free.
Back in Homa Bay, Cintas finds strength in peer mentor, a guiding light who walks alongside her through shared experience and unwavering support. She discovers the power of community in transforming her journey.
Working with these adolescent girls and young women, it's very interesting. Once you create a good rapport, they just come and search you. Where is this person? Where is this person? Because they know you. Through you, they can get good help. Through you, they can proceed. Through you, they can be linked very well in the facility. And I've been creating good rapport with them. And through that, they don't have, even if you contact somebody to come to clinic, through me, they just come. They tell you, today I have exam, I'll come today. We organize. I also reorganize with them. That's why it has been very easy to talk to these adolescent girls and young women, to mentor them. So I also tell them, if you have problem at home, you just come. We'll just do more, so that we don't want the GBV case. A young mother should be living at a safer place, and we have been very, very concerning that and telling them that if you are not at a safe place, just come. If you tell me this time, next time, because if you tell me this time, I have the records. Next time, if it's repeated, now it's too much.
Guided by mentors like Susanna Tieno, Cinta's story illustrates the transformative power of support and empowerment.
She used to come even pick me from school because she discussed the issue with the teachers, so they were aware. So she used to come and pick me from school so that I can go take the drugs. Until now, I can take them on my own without being told. Anytime if I go to the hospital, I'm being told that come back to this date, I don't fear. I just go back because life has to continue. Despite of everything, maybe that thing you have in your life has to continue. Yeah, you have to be strong and continue with your life. Don't look at what was done to you, what you are going through, what you have in your body. Life has to continue. Because the more you continue with your life, is the more better things you will achieve. It was not written for you. Something good was written for you to change your life and not to be a disgrace to your life.
Despite it all, Cintas remained determined, managing her medications, persevering, and finding strength in her mother's unwavering support.
To the society, let us not look down upon HIV positive people and these early pregnant ladies. Yeah, maybe it's because of how you handle them. It's maybe this nearness between parents and the girl, or it's a matter of peer influence. So don't always just see like this is a wrong person and you see that everyone is giving a negative model. You are being used as an example to others negatively. Let us not do that, but instead let us motivate each other.
Cinta's journey is a testament to this hope. Her journey from despair to resilience mirrors the journey of countless young women across Kenya.
I want to be a lawyer, a family lawyer. Why? Due to the challenges I do see in family, mine one of them. I just want to be that person to help those who are being abused in the family, maybe to help those women whom their husband are seeing like good for nothing. Yeah, so that's what motivates me, and that's why I want to be that family lawyer, at least to help those who are being abused in the family.
This is a narrative of breaking the silence of young women battling self-stigma and discrimination, not just within themselves, but within the fabric of society. It is a call for understanding, acceptance, and change.
Yes, we have policies, but a lot of work still has to be done to trickle down the guidance to the places where our adolescent girls and young women seek care. A lot more effort is required to really sensitize our health facilities, all our health cadres, including our community health promoters and community health strategy, to really trickle down those policies and guidelines towards equal access to care, towards adolescent-friendly services and person-centered services, so that the impact of the policies and guidelines are felt exactly where the adolescent girls and young women present for care.
As the sun sets over Lake Victoria, we reflect on the journey that has unfolded. From Homa Bay's tranquil waters, we bear witness to stories of strength, unity, and transformation. Chemtai Kiri reporting for CAS TV from Homa Bay County.